Welcome to Humanley, the podcast providing allied health and integrative medicine practitioners with the most up-to-date, evidence-based and clinically relevant information. This podcast is a melting pot of ideas on health and well-being and does not replace the advice of your primary healthcare professional. Here's your host, Daniel Reuters.
Hello everybody and welcome to Humanley. My name is Daniel Reuters and today I'm joined by Dr. Janet Schloss. Welcome along, Janet.
Thank you, Daniel. Thanks for having me.
Oh, you're very welcome. It's so good to have you here. I think for many people listening, they probably already are familiar with your work, but for those of you who don't know you, you've been in practice for over 20 years as a nutritionist, and you've completed your doctorate at the School of Medicine at the University of Queensland through the Princess Alexandra Hospital. You've also been a lecturer at the Endeavour College of Natural Health, which was also the Australian College of Natural Medicine, and you were there for over 14 years. You're the clinical trials manager at the Office of Research, and now you're also doing some work at the Southern Cross University. Your main specialty, which most people are probably familiar with, is treating people with cancer. So you're really focused around assisting patients who are already undergoing medical treatment. You've got over 40 publications, and you've got a particular interest in research on complementary medicines to assist the side effects of chemotherapy and radiation. You've also spoken extensively throughout Australia and overseas, and you've got a very strong passion for your profession. So you're very well accomplished. Have I covered everything there? I think I have. I hope I have.
Yes, more than enough, I think.
Look, I've sort of been following your work for a number of years, and you know, when we talk about someone who is highly experienced in the management of people with cancer, your name immediately comes to mind. So do you want to give the listeners a little bit of background about sort of how you got into treating people or managing cancer with patients, and what has occurred over the last few years in regards to your research? Because you've been doing some pretty interesting things.
Well, I think it's interesting. I'm glad other people think it's interesting as well. But to answer your first question, how I got into it, like when I was studying to be a naturopath and nutritionist, like a long time ago, I have quite a number of family members who have had cancer. And one of them was my auntie. And she started seeing this practitioner who was up north towards Bundaberg, and he had no credentials whatsoever. And she basically told her not to have surgery or chemotherapy or anything like that, and gave her all of these different potions. And she ended up dying a pretty bad death, basically, and they've just continued to grow. So it was pretty horrific. And that sort of put me down a path going, you know, this is not right. We need to have very qualified practitioners in this area, you know, that can give these people the right guidance. So it became very passionate, as well as, like I said, other family members. But then once I graduated, I was able to get out, and I got a position working part-time with Henry Osiki at Orthoplex and writing technical information and books and stuff like that. And I said to him, you know, why don't we write a book just specifically on cancer? So we did. And that's, again, where I gained a lot of information and met a lot of different oncologists in part of my work from there as well, and it's just progressed. So that's a very quick overview of how I got into it. On the other side of things, I think some of the research that I've been doing lately is very interesting. My PhD was looking at chemotherapy-induced peripheral neuropathy and B12, but now I've sort of progressed into the cannabis world, and I really love it. So we've just completed, and hopefully going to get published soon, our results of our medicinal cannabis and glioblastoma brain tumour trial that I did with Charlie Teo. And we've actually got some really good results. And really, I think cannabis can play a big part in so many different areas, and it's an area that I'm passionately following and continuing.
So yeah, you brought up some really interesting points there. The cancer textbook that many nutritionists and naturopaths and herbalists may be familiar with, and it's the one that I'm thinking of, is the importance of clinical nutrition in the prevention and treatment of cancer. Is that the textbook you're talking about, or is it a different
this was
one?
a way long time ago. So in 2001, we did the first edition. In 2002 was the second. And it was Cancer, Nutrition and Biochemical Approach. And that then got rewritten and put into what the book you're now talking about.
I see. So you had developed the first iteration of that book that most people are using now.
Yes, a long time ago. But,
fantastic.
Things progress quite rapidly in this space, so it does need to be updated. So they did the right thing.
Absolutely. You've done so much. It's really, really important that we have people like yourself working in that field, because you're doing a lot of sort of integrative work as well. You mentioned you've been doing some work there with Charlie Teo around glioblastoma. What was it like working with Charlie?
Charlie is a really lovely person. I think he gets such a bad rap from a lot of his colleagues and stuff like that and what they say, but him personally, he is a really nice person. He really does care. And he's open to opportunities that may make a difference for people who have brain tumours. So he was great to work with. We ran the trial out of his clinic at the Prince of Wales Randwick Hospital, and we had fantastic dealings with him. We had no problems whatsoever.
I was going to say that research that you're doing was specifically for glioblastoma? Yes.
So one of the most, I would say the most aggressive brain tumour in adults. And, our stats for brain cancer in Australia and worldwide are absolutely horrific. It's the only cancer in 3 decades that's made no progression in treatment and survival outcomes. No other cancer has that. And so it's something that if we can make a difference to the survival rate and treatment options and quality of life of these people, it gives them hope. And, I've seen the differences that it makes, and I believe in it.
So why hasn't there been very much research or clinical advancements in the management of glioblastoma? Is it because it's just so difficult to treat, or it's a rare type of cancer and there hasn't been much attention given to it from a research perspective? Why is that?
Yeah, it's an interesting space. It's actually not a rare cancer. It's actually quite a common cancer. And there's in Australia, usually there's around 1,000 people each year diagnosed with GBM. And I think that the hard part is that this type of cancer comes back, I would say 95% of the time. So when you get diagnosed with glioblastoma, they basically tell you, well, it's going to come back. And you have about, maybe a year to 18 months to live, because that's what their actual stats are from it. The hard part out of all of it is that, treatments to get into the brain by the blood-brain barrier or by radiation is limited. So, there's only a couple of chemotherapy drugs that cross the blood-brain barrier. Radiation, depending on where it is difficult. The other thing is that glioblastoma has legs. It's not like this beautiful little contained round object that they can actually remove. So it has all these little legs that can go into everywhere. So it's very hard for surgeons to actually remove the whole tumour. And that way they can say they can debulk it by, 80% up to 95%, but there's always parts of it that they can't remove. And that increases the risk of it. So there's some of the limitations for it. So that it's about coming up with drugs, and I'll call cannabis a drug, even though it's a plant, but we're using it as a drug, that does actually cross the blood-brain barrier and does have an effect. Which is one of the reasons why I think there hasn't been a lot of research into glioblastoma, is because there's very little drugs that do actually cross the barrier. And the other thing is that we need to also start looking at different ways of application, of getting past that blood-brain barrier. Maybe it would be nasal application or different things as well.
Everything you've been saying there has been reminding me of a family member that has been living with glioblastoma for a number of years, and she was actually diagnosed at a point in time where she had two very young children.
Yeah.
I believe they were under the age of 5. The cancer was in a part of her brain that was extremely difficult to get to with surgery. And essentially, long story short, it was a matter of get your affairs in order. There's not a lot that we can actually do for you. They did attempt a surgery, but they couldn't remove the bulk of the tumor, and it didn't look good. So I think at that point in time, she had spoken with her doctors around the use of cannabis, and they essentially said, we're probably going back close to 10 years now, but at that point in time, they essentially said to her, we can't recommend it for you. It's really up to you whether or not you choose to do it. So she did actually start making her own cannabis oil. And I think from the time she started using that cannabis oil to the time she had her next scan, the tumor had shrunk considerably. And then the next scan after that, essentially they couldn't find the tumor in her brain. So I'm not sure if that's a common thing that happens when people are using this, or if she just got really lucky, but she seems to have been able to get to a point now where she's living a relatively normal life, and she attributes a lot of that benefit to the cannabis oil that she was using. So I'm not sure if the clients that you're seeing are getting similar results.
That's a fantastic story, and I love hearing that. The problem is that we still don't know why some people respond really well to it and get great results, and then other people don't. And that's why we still need so much more research. And there's been so much opposition to cannabis in the cancer space, but now that's starting to change. It's been always around the symptomology of people rather than treatment or an adjunct to treatment. But it's still going to be a long way because a lot of the oncologists are now being faced with this, and surgeons, I would say that as well. And we have to do trials, and that's the only way that they will actually get past this. And at the moment, they still can't say, "Oh, we're going to recommend this because you have glioblastoma." We still don't have enough evidence, even though we've had very positive results from the trials that have actually been conducted. But from my perspective, what I've found is that some people respond really well and they have these amazing results, but then others don't. And that to me is really interesting. How do we know who's going to respond and who doesn't? So it's an area that we're actually looking into, and how we can find that information out. And that's one of the reasons why we're doing different PK type work and looking at different biomarkers that may be able to tell us who's going to respond better to this.
Do you know why people have a higher risk of getting glioblastoma? I remember listening to a presentation that Charlie Teo was doing, I think at a university in Sydney with another professor. And I remember this so well because I was completely blown away by one of the main reasons he said that people get brain cancer. And it was from the use of mobile phones. And I remember him mentioning that your risk is increased significantly if you're considered to be a high use mobile phone user. And I think it was only around half an hour of mobile phone use per day, which was considered high use. Are you familiar with that information? And do you know of any other things that can increase your risk of glioblastoma?
It's really interesting. I am very aware of that, and I'm very aware that Charlie totally believes that. And the hard part is that he's up against opposition from mobile phone companies and a whole range of other people in technology to say that's not actually the case. But reality is, I think that mobile phone use, when it's actually at your ear versus being away from right near your head, does have a play. There has been some research on it as well, with people sleeping with mobile phones near them, that has been said to increase the risk. but there's been no definite correlation. So what I'll say with that, I think that more research is required, which is always such a researcher thing to say. But I think that there's definitely a link, and I think that there's a risk factor for having mobile phones near your head a lot of the day, and particularly at night time. As for other risk factors for glioblastoma, nobody knows. There is some genetic testing being done at the moment. They do believe that there's some form of genetic predisposition in some people, but there's no other real risk factors that have come out to date, which is actually quite sad.
Because essentially that means that we're not sure how to prevent it.
Correct. We don't know how to prevent it.
And we're also then not sure how to treat it effectively, which is why I guess you were so interested in the cannabis, because it is a potential treatment that can be used.
That's correct. I definitely think that it has a high potential. And there's when I first started looking into cannabis and I was looking at all of the research, there is a plethora of in vitro information, and particularly around glioblastoma. And it was one of the only real studies that had actually started there, with one over Gomez over in Spain, who actually put cannabis directly into the tumor in the person's head for 9 people, which is pretty amazing to get the ability to do that. And it really interested me that this has a potential treatment. Like all the in vitro ones in particular show extremely good signs that this could actually work. And the other thing is that there has already been studies done with GW Pharmaceutical over in UK showing that, it actually potentiates the survival rate from people in conjunction with temozolomide, which is the main chemotherapy drug. So not only is that could be an adjunct, but I do know other people using it as its own as well. And without having to have some of the more destructive treatments, I guess is one way of putting it. But it's an option. But I think the biggest thing is that we need to know, like most other things, who's going to benefit and who won't benefit as much.
So you mentioned earlier that it's actually quite efficacious at getting into the blood-brain barrier. Why is it so good at doing that?
Because cannabis is an oil-based thing, so it's very fat soluble, and so it's easy to actually cross over. The other thing is that obviously cannabis works on the endocannabinoid system. So we produce naturally endocannabinoids every day that do cross the blood-brain barrier. So it has an easy access into the actual brain. And we have a lot of our CB1 receptors are located within the brain, which is why THC actually binds a lot to them. And they get that psychoactive or, stoned, I guess, type feeling. A lot of the medicinal cannabis in the oils don't actually do that stoned type feeling if it's done correctly. But it can make you feel quite relaxed. It can make you feel drowsy. And it definitely has that effect within the brain itself. So, and that's one of the reasons that it said, there's not many things that can actually cross the blood-brain barrier, and that includes nutrients. Not all nutrients cross into the blood-brain barrier either. So having something that is fat-soluble that does actually cross and has a potential for benefit, you can't go past that.
Is the psychoactive component part of the therapeutic effect in your opinion, or can we actually just go with some type of therapies which remove the THC and just use the CBD?
See, this is a big discussion point in a lot of people who are looking into the cannabis. And part of what we realize is that all the side effects mainly are from the THC component. However, a lot of the in vitro work actually show that it's the THC that has some of the anti-cancer activity. But if you actually use the CBD with the THC, the CBD can mitigate or down-regulate a lot of those, what we consider psychoactive type responses in people. So it's not like you're smoking like an indica bud or anything like that. Most of it, what we're looking at is a whole plant extract from a sativa plant. So it's not just the flowers, it's actually, all the leaves and stuff like that are actually used within this to give us all the extra cannabinoids that come into play. And you know what? I think we don't even know, there's 140 different other cannabinoids are in cannabis, as well as like other 300 different constituents that come into play, like all your terpenes and stuff that will also have a benefit, which is then like obviously your entourage effect, which it's so funny. Entourage effect is actually put into cannabis, but it's every herb has an entourage effect, which is why you can't isolate anything. But to answer you, I've sort of gone around in a couple of different circles there, but I still think that that in certain situations we can use a high dominant CBD with a low THC. But if you're wanting an anti-cancer type effect, then you really need a 1-to-1 ratio of CBD to THC and slowly titrate up to tolerance, so you don't get any of those adverse events or psychoactive is not one of the words they really like, but brain-changing type effects.
Because when we think of all of the herbs that we've been trained to use in herbal medicine, we talk about the synergistic effect.
Correct.
So it's important for us to use the whole plant or the parts of the plant that have been shown to be the most beneficial or medicinal. But for some reason, there just seems to be this thought process around cannabis that we can extract one component out of it and it's going to give us all of the beneficial effects. So hearing you say that actually, no, we need to use the whole plant really is a nice thing to hear, because I do think from the research that I've read, using that whole plant component is probably where we get obviously that synergistic effect and then a better therapeutic value from that plant.
Oh, totally. When we're looking at the literature again, you can see the difference between the synthetic plants, like cannabis drugs that they actually use versus the whole plant drugs. And you can see that the entourage effect of the whole plant makes a big difference. And that's where you can't just single out one thing. And as a herbalist myself too, I believe in that whole plant aspect. And you can't just isolate one. I remember going to this lecture from a professor from Germany. He's a psychiatrist and he was investigating the St. John's wort. And obviously at that stage, this is like I'm talking probably 18 years ago now, but he looked at it. So he was trying to isolate, the main components and see what neurotransmitters they actually worked. And what he found was that when he isolated it, it hardly stimulated any of the neurotransmitters at all. But when he actually used, and he had 4 different types of isolates that he used, but when he used the whole plant extract, it actually increased the serotonergic, the dopaminergic pathways, and GABA pathways quite exponentially. And he, as a pharmacist and professor, he just couldn't get his head around the fact that only the whole plant that did that rather than the isolates. And that goes for every herb as far as I'm concerned.
I agree. I think we need to get back to our fundamental underpinnings of herbal medicine, and rather than us trying to pinpoint or isolate the component that's actually having the effect, well, it's all of those components combined that are having the effect. And I don't think that any amount of research is ever going to be able to understand exactly why that is the case.
No, I totally agree. And if you're going to bring it back to cannabis, it's actually one of the reasons a lot of doctors find this, frustrating to actually dose and to look after, because it's not something that they can say, well, you take this dose for this amount of time for this type of effect. It doesn't work like that when you're looking at a herb. And that makes dosing very difficult. And it's one of the reasons why there isn't no set dosage regime.
Janet, there's a number of naturopaths and herbalists who are actually involved in the research of cannabis. One name that comes to mind is Justin Sinclair. I know that he's been sort of focusing some of his research in that area. What I've always wondered is, though, why are naturopaths and herbalists actually involved in the research side of things when we may not be able to ever prescribe it, because there are a lot of legalities limiting the use of cannabis in Australia?
I totally agree. And I love Justin Sinclair's work. Actually, he's a good friend of mine, and he's been doing research into this area for 20 years. But one of the main reasons why I think that Justin, myself, and quite a number of other herbalists and naturopaths are doing research in this area is because we actually understand herbs. we have the background knowledge of how herbal medicine is worked and how we do dosages and what research is actually needed to do it versus, say, a pharmacist or doctor researcher who likes to isolate components and then check that out, which is a very scientific basis. So to me, it makes sense as a naturopath and herbalist that we do some of the main results and research on these particular plants moving forward that can then give evidence and information to doctors and to pharmacists and stuff like that who are actually prescribing. And you never know, like I think someday we might be able to prescribe CBD, but not THC. And I'm really happy with our regulation in Australia that it is distributed by pharmacy, that pharmacy have regulation over it, and that there are ways, particularly with THC, that not everybody can actually get it, compared to like Canada and America, where you can just go in and just buy it if you have like a tag or whatever. But I still believe that we are the best placed people to do research with a herbal medicine that is a drug.
What's the best way for people to be getting the active components from the cannabis? Is it in an oil extraction? You mentioned before that smoking it may not necessarily be so useful. Are we using dried herb? What's the best way to administer this?
This is a really interesting question. And the answer to that is actually quite complicated because a lot of the time we don't know. There might be particular ways of taking cannabis that will benefit a particular condition or symptom. I said about smoking, but vaping is really good for intermittent pain relief. So there's a lot of that will actually be of assistance because it gives them more of an instant response versus an oil, which is more for like low-grade chronic pain because it takes anywhere between 2 to 3 hours to peak within that person's system. So the other people may get benefit from actually like juicing up the leaves and flowers and drinking that, depending on what symptoms that they actually have. So at this stage, it really comes down to the person, what they're wanting to achieve with the actual cannabis, and how what method that we actually implement it. So, as I said, it's a really good question, and maybe using a few different variations of that may help. And I haven't talked about like topical application or suppositories or I said possibly nasal or your oral or buccal absorption. So there's so many different aspects to it. But I think it's great. We just have to find out what's going to work for the right symptom or condition.
So you have a client coming in to see you who's got a cancer. How do you know that cannabis might actually be of benefit to them? At what point do we say to our clients, look, this is something that you need to explore with your doctor?
So one of the things I have with cancer is that every cancer is a different disease and every body is a different person and individual, and that not one thing is always the best for each person. So the way that I work is, number one, is where they are at what staging that they're actually at, what type of cancer that they actually have, what treatment they're being given, because at this stage we still need a lot of PK work to find out, what interactions that it has. We know that there's a lot of different immunotherapies that it can't be used with. There's certain medication that it can't be used with. It can't be used with people who have high liver or like high liver enzymes or kidney damage or have had myocardial infarctions or anything like that. So we start to know what cohort can and can't use, or if they've had a bad experience on cannabis in the past, or they have an addictive type behavior. However, in saying that, cannabis is not addictive. People think that it may be, but it's actually not addictive, which is a good thing over opioids and some of the other medication. So when a patient actually comes in to see me who has cancer, and it's not something that I will recommend straight away. A lot of people now come because of my research and I guess that fact that it's out there, will come and ask me lots of questions about cannabis. And I don't always recommend it to everybody for their type of cancer, and it also depends on their timing of it. And I don't believe that it's of benefit for every type of cancer either. So that I think we still need to have a lot of evidence to find out, like I said, which ones that it will. But I do believe that there's quite a number that can actually have benefit. So to answer your question, I don't know that I'm going to when and how I'm going to recommend cannabis to everybody until I actually know more about their story.
There's so many other uses for cannabis, isn't there? Most people consider it to be used for either shrinking the size of the tumor or for reducing pain. But there's also lots of other amazing benefits, like it being a digestive stimulant.
Yeah,
Because a lot of people who are undergoing chemotherapy have muscle wastage and nausea, and they made it actually feel like eating. So cannabis could help there, right?
absolutely. And actually, one of the best things about cannabis, and particularly when you're looking at THC, is that it helps with sleep. And sleep related problems, especially with people with cancer, is major. And when you're looking at brain tumor people, you're looking at them being on dexamethasone and actually quite a number of different ones that affects their sleep. So helping them get a good night's sleep makes a big difference to how they feel. Like it increases their cognitive ability. It increases their energy. It has this whole follow-on effect. But it's not only just sleep. It's not only just pain. It's not only stimulating the appetite. It actually works on, like the CBD component works on your immune system. That actually upregulates to help with decreasing anxiety. It actually helps with relaxation. So I think cannabis has like a plethora of different actions that can be of benefit to people, but not to everybody.
Have you found that many of your clients are resistant to wanting to use cannabis because it does have a bit of a bad rap, or it has been given a bad rap in the past? I remember back in the 80s, there was an ad going around on TV, and you might actually remember this as well. And the ad was, I think it was of a guy who had some cannabis and he became really erratic and he was becoming violent and he was causing problems in the public. And there was this public health message that if you're on using cannabis, you can become a violent offender or a violent person. So it's sort of gone from being a drug that you don't want to be associated with at all when it could be seen to be causing a lot of negative effects. Do you think that there's still bad connotations surrounding the use of cannabis for some people?
I found that ad. I know exactly what you're talking about. I thought that's absolutely hilarious because this is the one drug that does not cause that. It has the opposite effect. It puts most people to sleep and makes them more relaxed. It's a completely different kettle of fish if you start talking about methamphetamine, which has more of that effect. I do think, however, that there is a stigmatism associated with cannabis, and that's where there is a lot of, actually not a lot, but there's a certain amount of people who are resistant to wanting to take it or to try it. And the stigmatism is more around the fact that it was made illegal and about people smoking or they've seen, people smoking it and they've like triggered schizophrenia or something like that. However, I can tell you a number of my patients that I've worked in conjunction with doctors who had that same feeling and they didn't want to tell anybody that they were actually taking it for different reasons, for different things like ankylosing spondylitis or fibromyalgia or stuff like that. And they were finding benefit, but they found it difficult to be able to tell people that they were taking it, and particularly the older generation. And that stigmatism is hard to get past. But that's where we need to make a very big distinction that this is a medicine. And it's a herbal medicine. And it's been around for like so long, starting in China. And it was the American people who actually banned it and was given it the stigmatism. Before then, it was only found to be of benefit. And we still that needs to be worked on a lot because it's still quite strong in the community.
And that was my next question. How do you think we actually overcome that stigma?
I think overcoming the stigma is number one, is educating people about it. And when I talk to people about it now and explain how it is a herbal medicine, this is how it's used, the problem there, it's not like you're smoking things or having that instant high that you see. So it's just like you're taking any other herbal medicine. and we're using it in a slow titration, so we don't get any of the potential side effects that you could get from it. And once they actually wrap their head around that, it makes a big difference. But the problem comes down to that you can have one person or a few people telling that, but how you educate everybody. The other stigmatism is, and the issues are with the doctors. You've got doctors who are a bit worried about actually starting to prescribe it, because then they're going to be seen as these cannabis doctors that people will then start coming and asking them for it, and they don't know enough about it anyway, so they don't want to then prescribe it to their patients. You've also got people who are in the medical profession and outside of it as well, saying quite a lot of negative things about it because they don't want it to become mainstream. But the problem is it's going to become mainstream. It already is mainstream now. And so it's more about, let's understand what this actually is. Let's get a grasp on it, that this is actually a herbal medicine and it's a drug, and that we're using it for specific reasons. This is completely different to recreational use.
So if there's somebody who actually wants to get access to cannabis, what's the best way for them to get it? Because I'm not sure if every GP can actually prescribe it, can they? Or is it a specialist type of medication at this stage?
Any GP can actually prescribe it. Any GP, any medical specialist can actually prescribe it. It's if they choose to do so or not. So if someone is wanting to have or gain cannabis legally, and I prefer the legal over black market, is that they need to, number one, find someone who is willing to prescribe it. So they have to then go in and they talk to them. They do have to meet the regulations, and it's much easier now to actually gain legal access than what it used to be. You do have particular people who are used to prescribing, and they will actually get a quicker permission than, say, a GP or someone who has never prescribed before. But the government actually helps them out, so that's not the issue. So if you're wanting to do it, you actually have reasons to wanting to use cannabis. Find somebody who is actually able to prescribe it or willing to prescribe it to you. Some of those specialist GPs do actually want a referral from your GP or a medical specialist, so you will actually have to ask that. But it's becoming a lot easier, and a lot more people who are actually now prescribing it.
It's really good to hear that it's becoming easier for people to get access to, because I know that things like chronic pain can be really difficult to manage. A lot of the pharmaceutical drugs that are available currently don't even really touch the sides of a lot of people's pain. So have you found cannabis to be sort of the most effective measure at reducing pain, or are there other things that we can use now?
You know what? Pain is a really interesting thing, and it is, like you said, it's really difficult to manage. And cannabis does, in a number of cases, work exceptionally well for pain. But then you've got other people where it does not touch the sides for their pain. And there's still this debate at the moment about cannabis and pain with some of the medical specialists. But I think that it does actually work for pain, both nerve pain, low chronic pain. Some of the acute pain is where you will have the vaping side that does actually help. And it doesn't have that addiction and side effects that, a lot of the opioids that they actually use. Some of the time, so they can actually, depending on the person, have a mix between, say, using cannabis and reduction in their pain meds, but they find what works for them. So pain is so hard, it's so easier said than done. But you've got a whole things that affected pain expectancy, beliefs, how long since they've actually been dealing with this, their quality of life. So it's not just one thing that you can actually measure.
Right. And in practice, are you using cannabis by itself, or are you incorporating it with various other herbs and supplements as well, not just for the pain, but as an overall holistic approach? Have you found that there's a specific herb or specific nutrient that actually complements cannabis quite well?
I think there's a number of things that complement cannabis, but yes, so in clinical practice, I definitely use combinations of both different herbs and nutrients to help with people's pain, depending on what has actually caused it, or where it's actually coming from for them. And very rarely do I use just cannabis by itself. Sorry, I went on to the medical side before, but on the nutritional and herbal side, I mean, some of the things I use quite extensively is boswellia and turmeric and ginger in different combinations, or PEA for some people instead of cannabis, just to see how they actually react. And all of that can be great. But then, you've got some of the things from, say, let's say chemotherapy-induced peripheral neuropathy or diabetic neuropathy, and you'll find that like things like B1 or lipoic acid or acetyl-L-carnitine will be more effective in regards to that, or B12. So I think it's always an individual case that cannabis can play a part. In regards to what actually works together, again, it's very individual. I think it depends on the person, their situation, and what their body actually requires at the time, which is, that's how we work. We're naturopaths. We're very holistic, and nothing stays the same all the time.
Do you know if all cannabis is the same, or are there different strains of cannabis that actually have different effects for, say, the nervous system, and then another form may actually have a better effect on the gastrointestinal system, and so on and so forth?
See, this again is a really interesting question, because you have all these different cultivars, and it depends on where the mother comes from for the actual plant, and every crop can actually be different. And they can have, depending on their growing environment and what actually happens, and from there you can have ratios of different cannabinoids or things that come out of that particular batch. And that's one of the hard things when you're producing cannabis products, is that consistency of it. And in saying that, it can all vary. Didi Madiri, who is in Israel, is probably is the leading person, I think, in cannabis. And they were doing some research over there in Technion for child epilepsy, and it was working exceptionally well. And then when they introduced a new batch, suddenly it wasn't working, and they ran all these tests and basically found that there's one in particular, cannabinoid, wasn't there anymore, and that must have been what was actually working. So not only can it be like you can use the same plant, get the same batch, but that variation makes a big difference for like anything that you're actually using it for symptoms or for treatment or anything. So the answer to that is absolutely yes. And the other thing is, then we also need to find out, what's the ratio? Do we have low THC, it's a high CBD dominant? Do we do a 1-to-1 ratio? Do we do a higher ratio, 4-to-1 or 20-to-1 of different THC to CBD? But we're now also seeing, more dominant type cannabinoids also coming out. So at this stage, it's a really hard type stage to quantify. And even like I said, batch to batch can actually be very different. So something we are still working on.
And is that something that the medical fraternity is aware of, or are they just sort of thinking along the lines of, well, we just give cannabis and it's all the same, or people like yourself and Justin actually making them aware that, no, actually, you need to be strain specific here?
There's a lot of people that are making them aware. I think that there's certain medical fraternities that, are unsure of that, but most of them are actually aware that there are different strains and that you do need to have a look at different ratios. And that's one of the things that why they don't want to prescribe, because it is quite daunting. And the ones who are prescribing are still learning. And that's not just here in Australia, that's all over the world.
You mentioned earlier as well, in regards to chemotherapy-induced neuropathy and diabetic neuropathy, that cannabis works particularly well. So it's actually got a really broad therapeutic use. Can you think of any other instances where you actually might want to use cannabis? Because most people, when they think about it, they think pain, and they think using it to help with the management of cancer. But things like chemotherapy-induced neuropathy, that's so debilitating on people's lives. And I know that they try and use things like acupuncture, for example, which can help. So it's not just necessarily the cancer itself. It can be the side effects of treatment that cannabis is good for as well, right?
Absolutely. And that's where I think it plays a major part. We're starting to put it into little boxes, and what I will say is it's not good for everything, but I think that it has a potential benefit for a lot of different areas, and we can't just say, okay, it's just for cancer, or it's just for epilepsy, or it's just for pain, or that type of thing. I think that's where there's more research coming out, and it can help with side effects from different medication. It can actually help with different conditions. There's a lot of research now going into like Tourette's syndrome, schizophrenia, which it can actually cause, but can actually be of benefit as well. Parkinson's disease, MS, multiple sclerosis, or there's a whole range of other disease states that it's now starting to be looked at as a potential treatment. And that to me is actually quite exciting. And we need to not just put it in a little box and say, well, it's only for this type area. We definitely can't do that. I think that it has immune modulating type effects, which is why it can actually help in certain autoimmune diseases. So there's so much more research that can be done on this particular plant. It's amazing.
Speaking about the research side of things, if there are students who have not yet graduated, or there are clinicians who want to do research in this area, a couple of points here. So A, how do they get involved in it? And B, are there any research facilities that are better than others? Where do people really need to sort of do their inquiries? Is there a specific university in Australia currently leading the way?
Yeah, there's actually 3 or 4 of them that are actually leading the way in cannabis research. Probably the most well-known one is the Lambert Institute at Sydney University, who were benefited from philanthropists. There's the NICM, which is Justin Sickler, leading the way there with the cannabis area for the Western Sydney University. There's ACAR at New South Wales, who they got national funding to run a cannabis research from there. There's some also down in Melbourne that they can actually approach. SCU now actually has quite a lot of cannabis. They have plant science actually run and evaluating a lot of the cannabis that's actually there, and now they've got me obviously as well, who can run clinical trials. So there's actually quite a number of different universities who are quite specific in cannabis and the studies that go on there. So if clinicians or students who are wanting to study want to get into the cannabis space, you'd be wanting to look at those particular universities to maybe do honours or masters and stuff like that. And, even getting to a position like I know the Lambert and ACAR are offering PhD specific scholarships there on cannabis.
If students or clinicians are interested in getting some additional information, are there any resources that you would recommend for them to read? Any standout books or journal articles or papers?
There's so many journal articles and papers on cannabis and coming out quite dramatically. For people to actually get a better understanding and stuff of it, I would actually do one of the cannabis courses. United in Compassion, I would actually contact, and that's Lucy Haslam, and they have a lot of different resources on theirs. NIM, that was the other one down in Melbourne. They have some resources on their website, so does ACAR. They actually have resources as well. And David Caldecott and stuff actually run, I think, some very educational courses. As does over in Perth, there's a place, a medicinal cannabis group and Health House actually run webinars and courses of education for it. That's with Charlene and Paul Maver, and they're fantastic. So going to any of those are definitely going to be of benefit. I mean, there's other ones too that are run by some of the more clinicians, too, doctors, but for students who are doing naturopathy or nutrition and stuff like that, I would be more likely to do something with Charlene and Paul, or the united in compassion response.
Thanks for that, Janet. So the last question that I want to pose to you today is, where do you actually see cannabis use and cannabis research actually heading in the next 5 years?
Lovely question. I see CBD will be available on through pharmacy, and next year it goes down to a Schedule 3 from Schedule 4, so pharmacists can actually prescribe it to people. So it's already on the way down, and I think in 5 years' time it will be easily available on the shelves of pharmacies. THC, I think, will still be Scheduled 8 and be regulated, but the research is going ahead in massive amounts. However, everything takes time. And I think that in 5 years' time, we'll still be conducting clinical trials. We'll have a few more indications that we can actually get it prescribed for. But as a drug, it takes a lot longer to get the proper research to actually have it on a PBS, which is where I'm hoping it will be. Can't see that happening in 5 years' time, which will reduce the cost. Maybe in some areas it will be on a PBS, but I would say in 10 years' time it definitely will be. But I'm hoping, with Australia becoming more prolific in growing cannabis and producing and manufacturing it here, the cost of legal cannabis will drop dramatically and the access will become easier. And that's where I see it in 5 years' time.
There's so many unknowns about cannabis by the sounds of it, but I think that's what really makes it exciting, is that there's so much to still discover about this particular herb. And it sounds like, from the discussion that we've had today, that the potential uses and benefits of this herb are almost endless.
You would think so. I definitely think that there's a huge benefit in so many areas that it can have. There's definitely areas that it won't. But I think one of the main areas that we need to focus on too is why some people benefit and some people don't. So I find that very interesting.
Janet, thank you so much for coming along today. I really appreciate your time. I've learned so much from you in the last hour. Are there any final comments or things that you would like to leave the listeners before we wrap it up today?
Firstly, thank you so much for having me, Daniel. It's been an absolute pleasure talking to you. I would, if I want to leave it on anything, I think that people should learn about cannabis. I'm hoping cannabis also comes into the curriculum for naturopathy very shortly, because it is an essential herb and one we definitely need to know about. And if you get the opportunity, definitely go to one of the courses and learn more about it, because it's not going away. It's definitely staying here, and I'm excited about it.
Thank you so much, Janet. I look forward to talking to you again soon. Now, for anyone listening today who would like to contact Janet to find out more information about her research, or maybe you'd like to get in contact with her in regards to her clinical practice, you can actually head on over to her website, which is janetschloss.com, which is JANETSCHLOSS.com.
Thanks for tuning in. We hope you enjoyed the show. If you have any questions or comments, head on over to humanley.com/podcast and join the discussion. Make sure to follow us on Facebook and become part of our growing community of like-minded health professionals. Until next time.